Hi, thanks for joining us on EM5 today. I wanted to talk about ocular ultrasound. And there are a lot of great talks out there on ocular ultrasound. Hopefully I can point you in the right direction to a few and cover some of the basics today here. The indications for ocular ultrasound are as follows. Increased intracranial pressure. Say if you have some trauma, you're thinking of a bleed in the head or maybe pseudotumor. Also trauma itself. You can look for foreign bodies in the eye or even look at a globe rupture, although I would put the caveat that you have to be very, very careful when you think or are suspecting of a globe rupture. Also vision changes. You can look for retinal detachment, vitreous detachment, or hemorrhage. So the setup that you need, a linear probe, a lot of times we refer to this as the vascular probe. You need lots of gel, and I'm not just talking about a large clump of gel. You need a pool of gel. The reason for this is that you want to minimize the pressure that you're putting on the eye itself. And you can see in this ultrasound here, there's all this black above the eye, and that's just all gel. So that's to give you kind of an idea of how much gel you're actually going to put on there. Next, you can consider using a Tegaderm. Some people, just knowing where their probes have been, would like some kind of protection against the eye, and also just not to get gel in the eye. So one method brought up by this paper below is to put a Tegaderm over the eye and then do gel on top of that. After that, you're ready to scan away. Just have the patient look straight forward. You can later have them look side to side to help you get a full view of the eye, but for starters, just have them look straight ahead. You can do a longitudinal view and a short axis view. So I wanted to go through some anatomy. This is the lid at the top there, then the cornea underneath, and this black is the anterior chamber. Underneath that, you have the iris. You can see that on both sides, and then the lens shape under there, you can kind of see it lens shaped. And then all this black behind it inside the globe, that's going to be your vitreous. And then the retina is going to stretch all the way around. And last but not least, is right on the bottom here, that's the optic nerve. I just wanted to show this one other ultrasound picture here. This is a really great example of the optic nerve. I wanted to talk about a couple different things that you can be looking for on an ultrasound. One is increased intracranial pressure. I think that's a really great one that you can use to measure maybe in a patient that you don't have time to run to the CT scanner quite yet. So the rule for this is going to be 3 down and 5 across. The reason for that is that you want to be measuring the optic nerve diameter 3 millimeters posterior to the globe. So here you can see on this picture we're measuring 3 millimeters down, and at that point use your caliper on the ultrasound to measure the optic nerve diameter. So 3 down, 5 across. Measure both eyes and average them in order to get an idea if you have increased intracranial pressure. So many different papers have looked at this, and it seems that the consensus is that you should have a suspicion of increased intracranial pressure with an optic nerve diameter greater than between 5.7 and 6 millimeters in adults and 4.5 in kids. So the basic rule is that when you're greater than 5 millimeters, you should start having a suspicion of increased intracranial pressure. And this is just a great example from the paper listed below that shows a patient with a huge intracranial bleed, and then they measured on that same patient the optic nerve diameter and saw that it was actually 8, and you can see it's just bulging down here. It's a good example. Next, you can look for lens dislocation. This is a pretty neat example from St. Luke's Roosevelt Emergency Ultrasound. And you can see this disc right here, that's the lens. Really great picture. You can look for foreign body. This is a little bit of a cloudy picture, but these should be fairly obvious. You can also look for globe rupture. The structure of the globe itself is completely lost, whether it's the size or the shape itself. You can also see in less obvious examples loss of the anterior chamber. The major thing you want to be careful of here is not to be putting any pressure on the eye itself. It's a great example of having a lot of gel up here at the top so that there's no actual pressure from the probe onto the globe. Another really great use for ocular ultrasound is in vision changes, looking for retinal detachment. So here's a great example. You can see this very well defined. That's the retina coming off. Another thing you can look for is vitreous detachment. This is a little trickier. Usually you need to turn up the gain a little to see this. It's going to be a lot more web-like, not as well defined. You don't have that really nice membrane going across the bottom here. Neat thing about this, though, to kind of differentiate it, is to actually have the patient look left and right, and you'll see the vitreous swirling inside there. So just to go through these two differences again, with the retinal detachment, you're going to have a really nicely defined membrane where that retina is coming off. It's very easy to see. The other major thing is that there are 2 anchor points that the retina has. One is at the ora serrata. It should be the anterior up here. And the other is right at the optic nerve. So you should see the flap coming across here, but you shouldn't see anything lifting off over the optic nerve itself. That's in contrast to vitreous detachment, where there is no optic nerve attachment. So as you can see here, here's the line for the vitreous detachment. There's this big gap that goes right across the optic nerve. It also, like I mentioned before, is much less well-defined, kind of web-like, and will have that swirling appearance when you have your patient look left and right. You can also look for vitreous hemorrhage. These are going to be more kind of lines, dots, kind of cloudy again. You can see an example here from Sonoguide. So 3 things to remember for ocular ultrasound. Use lots of gel. That's for the protection of the eye and to get a great image. For the rule for increased intracranial pressure is 3 down and 5 across, and make sure you average both eyes. For retinal detachment, it should be very well defined. Look for those anchor points at the ora serrata and the optic nerve. And vitreous detachment is more web-like. You're going to see it swirling back and forth. Here's some great references for different podcasts. Thanks for joining us on EM in 5.